friends, today we are going to discuss about medical psychotherapy. I am Dr. Suresh Badadmat, Professor of Psychiatry, working at National Institute of Mental Health and Neurosciences, Bangalore. In this video, I'll be discussing about medical psychotherapy and medical psychotherapists. What are the advantage and disadvantage? What is the future of medical psychotherapy? Will be discussed in this video. Psychotherapy is an intervention aimed at helping individuals to overcome their various mental health issues. It is also called as talk therapy. The main disadvantage of this psychotherapy is access to psychotherapy, the cost, and stigma of seeking help from psychiatrist or from a mental health professional. This limits the use of psychotherapy. This video revolves around this publication by Mace and Healy, which was published in the journal called as Psychiatrist in January 2018. The title of the study is Medical Psychotherapy, a Specialty for Now. Please do scan this QR code to download the complete article. This is a very interesting article, that is medical psychotherapy. Medical psychotherapy is a specialized approach where a psychiatrist or by an MBBS doctor use psychotherapeutic technique along the side of medical knowledge and medicine to treat mental illnesses. It is particularly useful for complex cases, integrating biological, social, and psychological aspects for treating mental illness. Those who practice medical psychotherapy are called as medical psychotherapists. So, this is not the term which I am coining. It is a term coined by Mace and Healy. In Canada, there is Canada's Medical Psychotherapy Association. So, their motto is very clear: ensuring quality medical psychotherapy by physicians in Canada. Here, the doctors, that is physicians and psychiatrists, wants to provide psychotherapy. And they have formed an association where their quality control on psychotherapy is well monitored by the physicians group. And MedPAC is the association. Let's understand the classification of psychotherapy. Psychotherapy is practiced by either by a medical person who has done MBBS and a person who is non-medical. They are social worker, psychologist, nurses, and many other professionals who have been registered and trained in psychotherapy. If a person has done MBBS and if he has done psychiatry, then it is psychiatrist providing psychotherapy. Another one is non-psychiatrist providing psychotherapy. Now let's look into the non-psychiatrist providing psychotherapy. Here, the non-psychiatrists providing psychotherapy are oncologist, dermatologist, cardiologist, urologist, cosmetic surgeon, physician, emergency medicine, or any registered medical practitioner. Why oncologist has to practice psychotherapy? In simple words, the oncologists are dealing with a person who is having cancer. They may have to do psychotherapy. It can be supportive psychotherapy, grief therapy, end-of-life care. Support has to be given. Similarly, dermatologists who are providing care for a person who has various sexually transmitted diseases or maybe even sexual dysfunction. Cardiologist who may be encountering many people with panic disorder or else maybe obesity. Because of that, he has cardiac problems. To decrease their weight, he may have to do CBT for obesity. Urologist dealing with sexual dysfunction of male may have to do CBT for sexual dysfunction. Cosmetic surgeon may have to deal with BDD, that is body dysmorphophobia. Physicians will be dealing with various cases with regard to family issues, children, marital issues, may have to do supportive psychotherapy and various form of other psychotherapy. Emergency medicine, especially crisis intervention, motivational interview for a person who is using alcohol, or any registered medical practitioner need to inculcate psychotherapy in their practice. It may not be similar to providing psychotherapy for 45 to 60 minutes. It may be 15 to 20 minutes. Having this provides a holistic care for a patient. Let's understand the psychiatrist providing psychotherapy. What are the advantages? This is seen in US, Germany, Italy, and UK. They are called as medical psychotherapists, where a psychiatrist also undergoes training in psychotherapy. Germany is one of the countries where psychotherapy is well regulated by a law that is called as Psychotherapist Act. In Germany only, psychologists and psychiatrists are allowed to do practice in psychotherapy. France is also a similar country where only psychologists and psychiatrists are allowed to practice psychotherapy. Similarly, in Italy and Croatia, psychologists and allopathy doctors are allowed to practice psychotherapy. What are the advantages of psychiatrist providing psychotherapy? Invariably, the psychiatrist will be providing both medicine and psychotherapy. Hence, biomedical psychosocial model can be practiced. He knows about the organic causes and biological causes of any illness. Psychiatrist can balance both the biological reasons for the illness. At the same time, he can also provide the psychological aspects of the reaction to the illness. No need for one more consultation. The same doctor will provide psychotherapy and also medication. Continuity of care is well managed, and medical psychotherapy is well suited for chronic treatment-resistant complex cases. Invariably, nowadays, drug-assisted psychotherapy is getting revisited. Then, psychiatrist providing psychotherapy becomes very important. What are the disadvantages? Across the globe, there is a huge treatment gap with regard to mental illness. If psychiatrist starts providing psychotherapy, the people prescribing medication will be very less. Hence, they believe that many patients, again, treatment gap may increase further. Hence, many of them believe psychiatrists should give only medicine, not to do psychotherapy, because the need for treatment is huge. And they also talk about advocating for task shifting and task sharing so that the nurses, social worker, psychologists and other people can do psychotherapy and doctors can focus more on medication. Further, they also have found that medical psychotherapists are very expensive than non-medical psychotherapists. So these are the disadvantages of medical psychotherapist. However, as I mentioned, drug-assisted psychotherapy is coming back. An important article published by Goodwin and his colleagues in 2022. Here, psychedelics-assisted psychotherapy, that is, single dose of psilocybin for treatment-resistant depression. Here, the patient will receive psilocybin along with the psychotherapy. This was the multi-centric study which gave psilocybin in the dosage of 25 mg, 10 mg and 1 mg. Psilocybin 10 mg and 25 mg along with psychotherapy provided good response and a significant improvement was seen within 3 weeks. So the doctor here providing psilocybin and psychotherapy becomes absolute. Another study published by Smith and his colleagues in 2022 in Clinical Pharmacology. The title of the study is MDMA-assisted psychotherapy for treatment of PTSD. Again here, you are giving amphetamine and also doing psychotherapy. Hence, the doctor will be able to monitor both. Now let's look into the psychotherapy perception by the residents. That means, what do the doctors who are undergoing training, what do they think about psychotherapy? In this regard, in 1993, Dr. Shyam Sundar from NIMHANS, Bangalore, published an article. Here he talked about introducing psychotherapy for MD psychiatry resident at NIMHANS. Initially, in 1977, it was started as a pilot project to train MD psychiatry students in psychotherapy. In 1983, it became a part of the curriculum. Now also, on every Tuesday, psychiatry residents spend 1 hour with the supervisors discussing about the case they are seeing. That means for the next 3 years, they will be discussing various cases. They need to submit 5 cases. Of that, 1 complete case of psychotherapy need to be submitted before they take exam. In OCD clinic at NIMHANS, rigorous CBT training occurs. 1 month of behavioral therapy and 1 month of family therapy will expose them to psychotherapy. Further, in 2014, Kovac and his colleagues published an article in Academic Psychiatry. The title of the study is Psychotherapy Training, Resident Perception and Experiences. Here, they had circulated the online questionnaire. Out of 328 junior residents, 133 responded regarding psychotherapy. Majority of the residents said that current psychotherapy training for psychiatry resident is highly variable, but overall, residents wanted to undergo more psychotherapy education and training. This study highlighted that junior residents would prefer to have more hours of didactic instructions, clinical hours, and supervision in psychotherapy training. That means they had more information and also need for undergoing training in psychotherapy was established. Similarly, experience of a MBBS doctor who is a resident or an intern has written an article in psychotherapy in BMJ in 1981. That is Paul Garner. He talked about if a doctor undergoes exposure in psychotherapy, it will help to develop interest in psychiatry. Further, psychotherapy brings in a new perspective of holistic care in medical students or the doctor who are budding. Further, he emphasized 6th vital sign as an emotional vital sign by asking, how are you feeling today? Needs to be done to every patient when you are checking vital signs. Psychotherapy in medical illness who are having chronic illnesses plays a crucial role, and a holistic care can be given for a person who is having non-communicable chronic illnesses. There was another important review article which was written on what is the efficacy of teaching psychotherapy to psychiatry resident and medical students. This was published in Academic Psychiatry by Trong and his colleagues in 2015. They found 9 studies, in which 7 were from psychiatry residents and 2 for medical students. Unfortunately, the studies were very heterogeneous and they were very difficult to compare. However, the authors concluded educators should seek to evaluate and publish their findings when teaching psychotherapy to residents and medical students. That means if you are a psychotherapist training MD psychiatry students or MBBS students, please do research. By doing research, you will be able to know what is the effectiveness, efficacy, cost effectiveness, whether they have any side effects, review of tools, strengths and weaknesses of evaluating teaching various psychotherapy methods can be evaluated. That was the implication of that review. Now let's look into the non-psychiatrist doing psychotherapy. That means they are not psychiatrists but the medical doctors. Psychotherapy for medically ill patients. Review and critique of control studies. This is one interesting study which looked into various aspects. Further, psychotherapy need to be trained for cardiologists with regard to lifestyle changes. There are various studies looking into CBT for lifestyle changes, psychotherapy in cancer patients, grief therapy or family therapy to be done, psychotherapy in pregnancy and infertility. Nowadays, infertility and perinatal mental health care is becoming more important. And during pregnancy, psychotherapy is the mainstay of treatment, especially wherever the teratogenicity or congenital malformation because of drugs is a major concern. Psychotherapy in HIV and AIDS survivors, or maybe CBT to be done there. Psychotherapy in chronic kidney diseases. Supportive work for them. Supportive work with the donors. Psychotherapy in emergency department, especially crisis intervention, breaking bad news. Psychotherapy in asthma and COPD. Psychotherapy in obesity. Psychotherapy in irritable bowel syndrome, sexual disorders, sleep disorders. CBT is well known. CBT for medically unexplained symptoms. Psychotherapy for transgender and orientation issues. Any chronic illness, caregiver burden, supportive psychotherapy becomes essential. That means, my dear friends, majority of the PG students may have to be exposed to psychotherapy. By doing this, we will be providing a holistic care in medicine. If you look at the various articles published in scientific reports which talked about CBT for lifestyle changes, please do scan this QR code to download this article. CBT for obesity, again download this article by scanning the QR code. They talk about various module, outpatient module 1, 2, 3. If there is no improvement, admitting or a day hospitalization, residential CBT for obesity is done, module 4 and 5 and 6, and it has been found to be useful. Effects of psychotherapy in anxiety disorder. Again, it was published recently in 2024 in Journal of Psychosomatic Research. Please do scan this QR code to download this article. These are all indicates the need for training psychotherapy in medical PG students. Efficacy of CBT in insomnia. This is again a very important aspect. Please do scan this QR code. Read about this article. Behavioral therapies for treating female sexual dysfunction. A state-of-the-art review, which was published in 2022, is an important article where we need to train the gynecologist with regard to behavioral therapies. Scan this QR code to download this article. Now let's move into role of psychotherapists during AI-based psychotherapy. Artificial intelligence is cutting across our life. That means it is playing a crucial role in every aspect of our life, hence even in psychotherapy. An important article, Key Consideration of Incorporating Conversational AI in Psychotherapy. Minors and colleagues published this article in Frontiers in Psychiatry. They talked about 4 different types how therapists can use AI. One is therapist does psychotherapy without any AI. That is the first one. Access to care, there is no change. Quality is established. Rapport, there is no change. And unconditional acceptance is none, because the patient feels that the therapist may judge him. Therapist delivered but AI assisted. Again, because the therapist is delivering here, you need to train the therapist. Now it comes AI delivered psychotherapy, that is artificial intelligence is delivering, but it is supervised by a therapist. So the third one plays a very important role where all our doctors need to undergo training in psychotherapy so that they can supervise when artificial intelligence plays a crucial role in delivering psychotherapy. Another important article, Can AI replace psychotherapist? This was a publication done in Frontiers in Psychiatry by Zhang and Wang in 2024. They clearly said that AI lacks empathy at this point of time, but however, ChatGPT, that is conversational, AI is able to provide empathy responses better than human beings, but it cannot feel what the patient feels, but it is able to respond. But however, the study also says that in future, therapist-assisted AI psychotherapy is the future. Hence, we need to train all our MBBS doctors, PG doctors, and also psychiatrists in AI-assisted psychotherapy. What is the way forward? We need to introduce psychotherapy in MBBS and also in PG. We need to develop specific competency with regard to psychotherapy and also specific psychotherapy for PG students in their respective fields. Oncologist needs to be trained in grief therapy, supportive therapy, and if required, CBT also. That means specific competency regarding certain psychotherapy has to be trained. Further, AI-assisted psychotherapy and psychotherapist will be supervising. That needs to be the important near future development. Hence, we need to train our doctors here. Group psychotherapy can be most useful in chronic medically ill patient and should be exploited in medically ill patient. Structured training is essential. Manualized CBT is one of the way to go forward. At this point of time, should we regulate psychotherapy is one of the biggest questions which comes repeatedly. Self-regulation is the best way at this point of time. Simple reason is psychotherapy is a services provided by various professionals. Those professional organizations can regulate psychotherapists from their professional angle. To conclude, my dear friends, medical psychotherapy is an important current consideration which needs to be considered by National Medical Commission so that psychotherapy can be trained in our MBBS, opportunity be given to them, even for the PGs in their respective medical field, respective psychotherapy should be trained. That is, illness-specific psychotherapy need to be trained. Medical psychotherapist can provide justice by providing holistic mental health care. That is the way to go in near future. Thank you very much for giving your valuable time. Stay safe.